Next is hair shampooing. So what is hair shampooing? Hair shampooing, cleaning the hair by removing oil and dirt with the use of shampoo while the patient is on bed. The purpose is to clean the hair and improve the patient's sense of well-being. The materials are bath blanket, rubber sheet, two pails, shampoo, cotton balls, two bath towels, cali pad, pitcher, and warm water. Next is the procedure, which is the assessment. Check the doctor's order for hair shampoo. Assess the patient's condition like manifestation of fatigue, level of consciousness, and hygiene needs. In order to give a good shampoo for the client to ensure that the patient is good while doing the procedure so that to avoid any harmful. Next is the planning. Determine the need for assistance to prepare what the clients need and gather all the equipment needed to lessen time and effort. Next is the implementation. Identify the patient and explain the procedure. Provide for privacy, raise the bed to proper working level, and wash hands. Next is the shampoo hair as follows. Fold the top linen to the feet and position a bath blanket over the patient. Position the patient diagonally in bed. Place cotton balls on each ear fold. Cover the eyes with folded washcloth. Place a towel around the patient's shoulder and neck with the ends of the towel coming together in front. Place a cali pad under patient's head with tube extending to the receptacle water. Wet the hair and using a small amount of shampoo, lather it on hair and massage the scalp with fat pads of the fingers. Rinse thoroughly and apply cream rinse as desired by the patient. If hair is so dirty, repeat the step. Rinse thoroughly. Remove the cali pad. Pull the towel around patient's shoulder to dry the hair. Comb or brush and arrange the hair if allowed the patients to assist if able. Remove the rubber sheet and other equipment. Replace the patient in a comfortable position and wash hands. Next is the evaluation. Watch the patient carefully for signs of fatigue and evaluate as to comfort and cleanliness. Always become alert if the patient is good while the procedure is done. Last is the documentation. Record the procedure done to have a record and legal purpose in the future. Next is the back rub. So what is back rub? Back rub is a therapeutic massage done at the back of the client to provide comfort and to allow the care provider an opportunity for skin assessment. The purpose is to provide comfort to client, stimulates circulation and relieves muscle tension, facilitates therapeutic effect. The materials are the lotion or baby oil, soap, towel, washcloth, basin with warm water, and bath blanket. Next is the procedure, which is the assessment. Checks chart for information related to client's ability to participate in the procedure being planned, to recognize the patient ability and needs, and to observe the medication of the patient. Next is the planning. Determine assistance needed to secure the patient's need and to determine and obtain articles needed to determine the source of information of the patient. Next is the implementation. Identify client, explain the procedure to the clients, ask preference of the rubbing agent, provide for privacy, maintain a quiet and relaxing atmosphere, move the client near to your side and position. If client is able to move, instruct her or him to assume sitting prone position. Pour small amount of rubbing agent into hands and rub hands together. Make long firm strokes towards shoulders and back towards buttocks. Move hands towards neck and rub nape. Continue rubbing outward across the shoulder. Move hands downward to scapula and massage in circular motion. Rub in figure 8 pattern over buttocks and sacral area. Complete back rub by moving from shoulders to sacrum and back to shoulders. Reposition client and replace top linen. Remove excess rubbing agent used with towel. Raise side rails and place cool light within reach. return articles used in storage area, and wash hands. Next is the evaluation. Evaluate in terms of the following criteria, like fatigue, subjective feelings, and objective appearance of comfort, in order to know the past and the work client. Last is the documentation, client's response to back rub, condition of skin and bony prominences, BP and PR before and after the procedure, if the patient is satisfied with the procedure and to have a legal purpose.